Healthcare providers might be overcounting the number of children that are hospitalized with COVID-19. New data finds California overcounted child hospitalizations by at least 40%, potentially distorting the national figures on the effect of the disease on our children. So let's bring in Fox News medical contributor, Dr. Nicole Saphier. Good morning, Dr. Saphier.
Good morning, Ainsley.
Good morning. So this is based on two different studies. How did this happen? Why are these numbers inflated?
Well, Ainsley, undoubtedly children have been harmed as a means of some of the restrictions put in place to try and keep them safe from COVID-19. While we have acknowledged for months now that the risk to children is extremely rare in terms of hospitalization and death, about 77 times less than that for those adults age 65 and older, this new study out of Stanford may tell us that even our perceived low risk of severity in children is likely even lower than that. This data came out, they retrospectively looked at about 265 patient charts of children who were hospitalized and listed as a COVID hospitalization. Well, the data showed about 46% of those children were likely admitted to that hospital had nothing to do with the fact that they were positive for SARS-CoV-2. Now that hospitals are universally testing for the virus, when people come into the hospital, they're finding those infections to be incidental. And about 40 to 45% of those children were asymptomatic. So they just tested positive for the virus. And this just adds to the body of evidence that tells us that when children are positive for the virus, they have a very mild disease course, if any symptoms whatsoever. And you have to remember, Ainsley, we dealt with this a little bit last summer where they were talking about inflating hospitalization and death counts for people, even adults. And you know, we have to be careful because there is a perceived risk, and that is what a lot of these restrictions are based upon. But it is prudent that we get this risk right, as we know that we have harmed our children and adults when it comes to a lot of these restrictions. So this just, again, adds to that growing data that the risk to children is very low. And while more and more adults, young adults and adolescents continue to get vaccinated, and our percent positivity of tests have now hit an all-time low of about 2.7%, it's time to allow our children to get back to that level of normal life, knowing that they are not a risk to society and the risk of COVID-19 to them is negligible.
That's the problem with these studies. They inflate the numbers, and then our experts make decisions for our children based on those numbers. And then we find out months later or a year later, all of that was not necessarily true. Most of those kids that were still testing positive but did not have any symptoms were in the hospital for surgeries, cancer treatment, urologic issues, psychiatric issues. Thank you so much, Dr. Saphier, for being on with us.
Absolutely.